Hello, everyone. Welcome to Breathe Better and Live Better talk show. Today, we have one of the eminent doctor, Dr. Rashmi. She is an anesthesiologist and also holistic health and wellness coach. She is here to explain us about the respiratory system and the importance of our lung health. So let me introduce you all to Dr. Rashmi. So Dr. Rashmi is an highly experienced consultant and anesthesiologist in Karnataka, and she is also a holistic health and wellness coach with over 20 years of dedicated service in medical field. She has helped over 4,000 plus patients heal from their physical pain and achieve an improved quality of life. It's like mind blowing number, like 4,000 plus lives. It's not only about the patients, it's about the families. 4,000 families she helped. And Dr. Rashmi is now on a mission to address the emotional pain and promote holistic wellness. I welcome you, Dr. Rashmi, and thank you for accepting our request and coming here to share your experience and to share your knowledge with our audience about the respiratory health and lung health. Dr. Rashmi.
Thank you so much, Varadri, for having me here. It's a great privilege and honor to be here so that I add some points on the
Yes.
mission, what you are on. So, definitely, it's a great privilege. Thank you so
Yeah.
much for inviting me and looking forward for
Yes.
the greater session. Yes.
And
And
Dr. Rashmi, yeah. So I was very much inspired of the work you are doing, as well as also the coaching programs you have gone through. You have trained best of the best trainers in the world, and also you don't need to do them as a doctor, right? So I really wanted to understand. You took another step as a doctor. As a doctor, you took a better step, like to move another step ahead as a doctor to serve the people. So what really motivated or inspired you to learn about holistic health or to learn about life coaching?
okay, that's very interesting question. And definitely, I must say that this is a turning point in my life. Uh, Over the period of 18 to 20 years, as you said, I am in the medical field and I'm serving as a consultant anesthesiologist in the taluka place in called Gokak in Karnataka.
Mm-hmm.
So I always used to think, whenever my work is basically within operation theater. So whenever I used to meet patients before taking them inside the operation theater, I used to see them anxious and apprehensive. Then as soon as I would go, then I would just tell them, now that your problem is identified and it is going to be solved. You just have to have faith in God and you just have to take deep breaths. So that, those few words of concern words towards them, it would make them feel so calm. And I used to observe them over the monitor, either their heart activity or blood pressure or any other vital parameters. There would be drastic improvement. So as a result of that, so I felt, and also after the operation next day when I would go and meet them, and those again they would those eyes would look for those, you know sense of soothing words from me. So with
Hmm.
that I realized that yeah, definitely, even after healing their disease, okay, so healing has to happen. For the healing happening, there should be relief of emotional pain as well. So that's how I felt that yeah, I should take up this journey also. And added to that, when pandemic, like, COVID pandemic hit year 2021, so
Mm-hmm.
I entered the journey of self transformation, and I started certain rituals and healthy habits in the form of meditation, breathing exercises, and with that I felt phenomenal changes within me.
Okay.
So with that I felt, I could see the new Rashmi within me. So I thought, why can't I take this to the world? So many years I
Hmm.
have been working to save the lives of the people.
Hmm.
So I'm blessed to do this work, and I feel happy for that. And also I'm glad that I decided to take the journey one step ahead in into the changing the lives as well. So now I
Hmm.
am on the mission of healing the emotional pain. So yeah, that's how I am
Truly,
here.
truly inspiring, Dr. Rashmi, because I know, like, whenever I go to the doctor, like, they only think in the physical perspective. Like sometimes our emotional and mental problems aggravate as a physical problems, right? So the root cause lies in the emotional part or mental part sometimes. So it's very, very important to heal those mental and emotional wounds as well. Like, you are very inspiring, like your journey is very inspiring. We need more doctors like you in India, especially because by just treating physically they are not going to heal. Again and again they may come. So but like by treating holistically, for sure, like they're going to lead a happy and fulfilling life. And I respect your decision, and thank you so much for educating your patients on holistic wellness, Dr. Rashmi.
Yeah, thank you so much. And also previously you mentioned that it's not only the patients, those number
Mm.
of patients and their families as well.
Yes,
Definitely, because in a
yes,
family, if one person is suffering, it's like a whole family is suffering. Because
yes.
the balance
Hmm.
balance somehow it becomes
Yes,
imbalance, so
yes, true.
financially, socially, and
Hmm.
mentally. So yeah, definitely health is very, very important.
Hmm. Yes,
Yeah,
yes,
for
true.
that matter, we know, like, physical health as well as mental health, both
Hmm.
are very much important for the balance to happen.
Yes, true. So today's topic is mainly focused on respiratory system and lung health. Everyone got awareness, most awareness during the period of COVID, right? About lungs and respiratory system. Previously, we just take it as a granted. So it's already happening. Why should I take care of it, right? So today we are here to educate you all about the importance of respiratory health and lung health, so that you can make them strong and not to get affected with any diseases. So my first question to you, Dr. Rashmi, what are the benefits of maintaining healthy lungs?
Okay, that's nice.
Hmm.
So maintaining healthy lungs is very, very important. Anything whichever is healthier, that is always good. Even for that matter, when it comes to health, when it comes to lungs, also the same thing applies. So whenever there is a healthy lung, there is a improved breathing. As you all know, yeah, first of all, I would like to appreciate and acknowledge the audience over there. They, in spite of it being a Sunday afternoon, they choose to be here. And thanks to all of them. And coming to the question proper, yeah, having a healthy lung is very, very important. As we all know, lung, why, what importance of lungs is nothing but spongy like structure, air filled cavities. It is nothing, it helps for the oxygen to reach the muscles. So whenever there is a improved oxygen supply to the muscles, so the performance is better. Either it's a physical performance or a mental performance. So there will be, whenever there are healthy lungs, there is a improved breathing. Whenever there is a improved breathing, so there is a better oxygen supply, because once oxygen from the atmosphere breathed in through the nose, it enters the aeropharynx and to the larynx and the windpipe, that is trachea.
Hmm.
So from trachea, it enters the, which is divided into two parts called bronchi, and one to the right lung, another to the left lung. So they further are divided into smaller branches and ultimately leading on to the small air spaces called, the terminal branches are called alveoli.
Hmm.
Okay, they are like a sac-like structure. Those
Hmm.
alveoli are surrounded by the blood vessels. Okay,
Hmm.
so the oxygen exchange from atmosphere into the blood happens there. So
Hmm.
when there is a healthy lung, the atmosphere, oxygen from the atmosphere, it enters the body. It is also essential Once it enters the body, it should be exchanged in the blood, so that that oxygenated blood is carried to the several tissues and muscles of the body, so that it helps in the normal functioning of multiple organs of our body. And in the exchange of oxygen, there should be something else, right?
Yeah.
So with exchange to oxygen, they leave out the carbon dioxide.
Hmm.
So carbon dioxide is nothing but one of the agent which usually left out, and the oxygen is breathed in. So carbon dioxide is removed and oxygen is taken in and
Mm-hmm.
supplied to different tissues and organs of the body, so that normal functioning happens. And also what happens is muscles, for any physical activity, muscle activity is very much important. So whenever there is adequate oxygen supply, the functioning of the muscles is normal. So
Hmm.
patient can do activity, I mean person can do normal activity. For example, whenever there is a healthy lung,
Mm-hmm.
the depending upon the nutrition of the body, the person can go for a longer activity. In the sense, there won't be easy fatigability. Okay.
Hmm.
A person doesn't get tired easily, so he can run as long as, the maximum limit, so something like that. So
Hmm.
this is one of the importance of healthy lungs. And also, whenever there is a healthy lung, the immune system, the immunity of the person is strong.
Hmm.
So to be healthy, immunity, good immunity is very much essential.
Yeah.
So if there is a good immunity, then there is no chance of any other diseases. So the stronger the immunity, the healthier the person is. And apart from this, healthy lungs also help normal functioning of the brain as well. And person, and also mental health. Whenever there is a good lung health, good functioning of all other organs, the mental health is also be there. Lung health is directly proportional to mental health, as a way, in a way you can say that. So
Hmm.
definitely there will be a sense of well-being.
Hmm.
And yeah, and the sense of well-being is directly proportional to it creates impact in the social life, financial
Yes.
life,
Yes.
everything. If person is healthy, if he is mentally sound, he feels like going for work. He feels like
Hmm.
you know working to his full potential, so that
Yeah.
efficiency. Yes.
True. 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 So great, great. Like it's good to know the functions of the lungs. Like because we know that we have lungs, but we don't know what lungs does. So we only know that it takes oxygen and exchange the carbon dioxide. But in that process, like what exactly happening? Thank you for explaining us in easiest way and better way to understand. So nowadays, like many people are having some of the other respiratory problems. We can name many respiratory problems. So but how can one identify he's having a respiratory problem? Because identification has become very difficult. People just take it easy. Later on it becomes like bigger and bigger and bigger. By the time like they have to go for surgery or like permanent medication. So how can one identify this problem so that they can avoid the any bigger problems?
Okay, so the identification of the respiratory problems is nothing but the awareness towards the disease.
Mm-hmm.
Awareness of the disease. Either awareness can be of the normal health or the abnormal health, where the even person has even he should know whether he should be aware that whether he has normal lungs or abnormal lungs, he has any respiratory illness, or he is free from any respiratory illness, for that matter. So awareness is very very important. And respiratory illnesses can be in the form of either coughing, or change in the respiratory sounds, like wheezing is nothing but the whistling kind of a sound. Okay. And he may have a chest pain, and also he may be feeling tired, easy fatigability. All that can happen. For example, whenever there are so many diseases of lungs, to name some, uh, as bronchial asthma, bronchitis, pneumonia, tuberculosis, and flu, all such
COPD.
things. Yeah, COPD, chronic obstructive pulmonary diseases. So
Mm,
the illnesses can be in the form of cough. Patient can be person can be coughing, but he may not. He might think that it is a part and parcel of a life. Like sometimes he might think, yeah, it is normal, but it is
mm,
not that so. If person is having a persistent cough for more than 2 months in a particular year for consecutively 2 to 3 years, so it is termed as a bronchitis. So it cannot be taken as normal. So the necessary precautions and measurements have to be taken. So other presentations, clinical presentations of respiratory illness can be wheezing, as I said, and also person can have a shortness of breath, as
yeah.
though he's feeling air hunger. He's
Mm,
feeling difficulty to take the air in.
mm,
Okay, even though everything is fine, but atmospheric in the atmosphere oxygen is available, but he is not able to take the air inside. Why it happens so? It is exactly how happens is in case of airways, either bronchial asthma or bronchitis. It is nothing but the disease of the airways. I spoke about trachea, bronchi, and bronchioles, the terminal branches of the bronchial tree. So there, they are like a pipes. Okay,
mm,
so if there is an infection of those pipes, so what happens is that they are usually pipe-like structures. Whenever there is an infection or inflammation, or say for example in asthma, there will be spasm of those bronchi or bronchioles. So as a
mm,
result of that, air will not enter the lung. So patient, there will be availability of the air, but it is not entering the lung because there is a blockage. For
mm.
example, I'll just give an example. I think you must have you seen the touch me not plant. I'm sure
Which
many
one?
of them have touch me not plant.
No.
Okay,
Mm,
so yeah, okay, many of them they will be aware of it. They are like
mm,
they are small tamarind like leaves.
mm,
They are herbs. Okay, they are grown in the ground.
mm,
So as soon as we touch, usually they are open. Those leaves are open.
mm,
Okay. So as soon as we touch, they
mm.
just. So the
Okay.
same thing happens in case of bronchials, also in cases of asthma
Mm,
and
mm,
any bronchial diseases. So that pipe is blocked. They are
mm,
closed. So there
mm,
is no easy entry of air into the
mm,
so that they can reach the lung proper, like alveoli.
mm.
So there will be wheezing like sounds and the air hunger.
Yeah.
Okay, they are feeling as though they are thriving for air, and also chest pain will be there. It depends upon what part of the respiratory system is involved, whether it is lungs or the pleura. Pleura is nothing but covering of the lung.
Mm,
Um, Even in that case also there can be chest pain, and also if there is any accumulation of the fluid in the layers of the pleura, that is called pleural effusion. Even in that case also there can be chest pain, and also in cases of pneumonia, person can be having a cough with expectoration. Expectoration in the sense formation of mucus or phlegm. He will be able to that mucus like secretion whenever there is an
mm,
infection. So cough with expectoration patient can have, and there can be dry cough in certain diseases like asthma and chest pain, and there will be easy fatigability. Patient can have a easy fatigability. It is because whenever there is a infection, there is a pathology, then the decreased air supply, so
mm,
that to the structures like muscle and all, so person can feel very tired, easily
mm,
fatigued. that. And
Mm-hmm.
also they can have a fever also in cases of infections like pneumonia, bronchitis and all. Patient can present with a fever also. And there can be weight loss or night sweats. For example, if some cases of patients can have tuberculosis also. You might have heard of tuberculosis.
Yeah, yeah.
Tuberculosis,
TB is one of the biggest problem in the world.
yeah.
Hmm.
Yes. So tuberculosis, it's a infection caused by a bacteria. So in that, it is particularly characterized by night sweats and weight loss. So there are so many different kinds of diseases, but the common features are cough, fever, chest pain, easy fatigability, and air hunger. And yeah, performance is decreased. And definitely, when person is ill, his mental health also becomes ill.
Okay, great. So if anyone is watching, if you have these symptoms, you have to immediately take action. I hope this has given very much clarity on how to identify whether you have any problems with your lungs or respiratory system. So thank you so much for that clarity, Dr. Rashmi. So like we all are living in a polluted world now. All the metro cities, like the pollution rate is very high. Not even metro now, even semi-urban areas are also getting polluted. So how does the air pollution affect lung health and contribute to the respiratory illnesses?
Yeah, definitely. The polluted air has a greater impact in the disease of the lungs. It is because whenever there is a polluted air, it acts as an irritant to the airways. Okay,
Hmm.
if even it can affect normal person also, or worsen, it can worsen the diseased person also.
Hmm.
If a person is allergic to some particular substance in the
Hmm.
air.
Hmm.
If air is polluted, whenever he inhales those that kind of air, or he lives in that particular area, so definitely there will be some kind of allergens
Hmm.
which can irritate the airways.
Hmm.
So, for example, if a person is staying in the area where in that area, if there is a mill, like um, mill, like from which the pollutants are released, there may be, like person who is sensitive might have a persistent cough,
Hmm.
or persistent features in view of difficulty in breathing, or on and off fever. All that can be there. And all, if a person is sensitive, definitely this will affect that person. And even if he is normal also, it can affect if the person is sensitive. And what if the disease person is deceased?
Hmm.
Excuse me. So what if the person is deceased, because already he is suffering from either asthma,
Hmm.
pneumonia, tuberculosis, bronchitis, or flu, anything like that. So first of all, his airways have become sensitive. Whenever
Hmm.
the airways have become sensitive, and add on to that, if there are any pollutants, okay, if there are any pollutants, so they definitely worsen the disease condition of the person. Okay,
Hmm.
so that's how these better to avoid the air pollution whenever such a scenario is there. And if a person is forced to stay in that particular region, then he must take precautions to avoid those allergens, to avoid
Hmm.
those pollutants. Stay indoor as much as possible, and
Hmm.
use filters, and usage of air condition rather than a fan, and avoid
Hmm.
the dust, avoid the pollens, because some
Yeah.
people are prone for allergy to pollen grains and all. Like paddy fields will be there sometimes, during certain seasons. There will be like harvesting, and some winnowing and all will be happening. So the dust of those grains, if they are circulating in the air, so that can
Aggravate
affect,
our symptoms.
aggravate the symptoms, so that can be life threatening as well.
Oh.
because yeah, definitely, because in asthma there is one condition called status asthmaticus. Asthma itself is a it's a I have a greater respect for asthma, because it's such a situation. It's like uh, the airways are very very hypersensitive. Okay,
Hmm.
so whenever there is and patient is hunger for air, all those symptoms are there. If it is subclinical, fine, but whenever it aggravates, patient will have a difficulty in breathing, he will have cough, and also if such a disease is chronic, long standing. Okay,
Yeah.
to begin with, if it is only bronchial asthma, it is fine. Okay, so if it is only respiratory system disease, okay, fine. And if we take care of that, and in case if we try to avoid allergens, if we take care at the initial periods only, so that the next subsequent stages should not happen, then okay, the normality is preserved. But in case, okay, if the sensitivity increases, and whenever there is a bronchospasm is nothing but closing of those airways. Okay, so
Hmm.
there be, difficulty in breathing. So in that matter, either person has to take the medication which will dilate those airways,
Hmm.
prevent the inflammation of those airways. Okay, so
Hmm.
if it is if before that, person has to take care that such an attack should not happen. If at all, if he
Hmm.
is frequent attacks, so it's a great time, high time, that he has to look for a healthcare provider, and
Hmm.
the specific treatment has to be taken. And I was talking about if it is in the initial stage, it is okay. So whenever there is a fine, if the disease is neglected, for
Hmm.
example, person is having a COPD, that is chronic obstructive pulmonary disease, year by year, every year he almost gets it. Okay, so if at all, if it becomes longer standing, the respiratory system, how much, to some extent, it can tolerate the disease.
Hmm.
After that, it starts creating the side effect on the surrounding organ. So what
Hmm.
is the surrounding organ nearer to uh, lungs?
Lung.
Is the
It's
heart.
hard. Yeah.
So there will be back pressure over the heart, and the heart can go on to failure. So all
Hmm.
such things will be there. So it's always essential to identify the disease in the beginning, and better to avoid. As we all know, prevention is better than cure. So avoid the pollutants or the allergens, whichever are causing or are threatening in the form of disease or the infection or the problem.
Great.
So
Great.
yeah,
Yeah, like we don't take that seriously. Like it's
yeah,
very, very like important to identify, and also if there is a requirement of diagnosis, you have to go for diagnosis, and
yes.
very important to really understand. Yes,
Yeah,
definitely.
and also I remember, like it is a seasonal.
Hmm.
It's a very very important thing. Seasonal variation.
Hmm.
Usually the people with COPD or asthma, they are quite good, quite better
Okay.
during summer seasons. But during winter seasons or rainy seasons, their symptoms aggravate. It is because they have allergy to cold, and because of all those things, and also the intake of medications, if at all, like in the form of, if they are using the inhalers. So
Hmm.
inhalers during summer is totally nil, because I remember my grandmother, she was a known chronic, I mean, bronchial asthma patient. So I used to see her using inhalers. So her usage of inhalers would be minimal during summer, but it would
Hmm.
increase the frequency in during winter and rainy season.
Hmm.
So I have seen her suffering. So that's how, as I said, I have a great respect for bronchial asthma. And to that
Yeah.
matter, my mother is also a known bronchial asthma patient. But anyway, due to the right due to the approach in right time, uh, it is being maintained. So
Hmm.
that is the importance. As I said, the during summer they are usually better. During winter and rainy seasons, symptoms usually aggravate. and depending upon the medications or whatever is being prescribed, if it is properly taken in time, the chances of going into severity is less. That's what I just want to mention. Yeah.
Great, great. Thank you,
Yes.
thank you. Even the children are facing nowadays many
Yeah.
respiratory problems. It's very, very important for them to educate and take the necessary action before it become
Yes.
worst. Yeah,
Yes, Badri. You
and
have pointed out
yeah,
an important point, important age group, pediatric age group. Usually, I
yes,
have seen many, mothers. They say, "Yeah, my son, he's, allergic to ice cream. He's allergic to even the chocolates." I used to wonder what, but but it is all related to their allergic condition of the body. Yes, thank you so
mm,
much for reminding the pediatric age group.
yeah, yeah.
Yes, children.
So, and
Yes.
Dr. Rashmi, I have, I'm a breathing coach. I closely work with the people who are having respiratory problems. So, I want to know, in your perspective as a medical doctor, what do you think about breathing exercises or pranayama in terms of like medical sciences or in terms of health and keeping this, managing these respiratory issues?
Yes. Yeah, this is one important, vital point I must say.
Mm,
So, pranayama, yeah, it is nothing but the force, life force, regulation of the life force. It is very, very important. I myself practice pranayama. That's how I know the importance of
wow.
pranayama. Yeah, I must say pranayama or breathing exercises. They are nothing but it's like they are how yoga or gym is essential for physical fitness of the body, or how meditation is required for the brain exercise is meditation.
Yeah.
So in that way, the lung exercise is breathing exercise.
Mm,
Okay.
mm,
So, yeah, I would like to convince you more by telling that. Okay, it
mm,
is like, personal training sessions, taking the personal training sessions. Breathing
mm,
exercises are taking like a personal training sessions. If you want to look fitter, more efficient, people go for personal training sessions. So,
mm,
practicing breathing exercises are something like that.
mm.
Okay. And in other words, I must say it's like pressing the reset button.
Hmm, 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 hmm. Yeah, true.
Anyway,
So
lungs.
that's what like it's about managing, right? So they cannot completely like depend on medicines. So they also have to change their habits. So here comes like how does habits play a role in managing this?
Yeah, habits. Yeah, when it comes to habits, definitely healthy habits. So one of the healthy habit is breathing exercise and pranayama. As definitely they will increase the efficiency of the lung, and also uh, they improve the oxygen circulation, oxygen supply. Okay, in that way they are helpful. And also uh, um, whenever the breathing exercise happen, it's like there is a contraction of different kind of muscles, um, chest cavity, ribcage muscles,
Diaphragm.
diaphragm, abdomen muscles, and
Abdomen.
also pelvic floor muscles. So so with this there is a better exchange of air.
Hmm,
Okay. So uh, that's how it impacts.
hmm. And also, I would like to curious to know. One of my student also asked. So does stress play any role in respiratory problems?
Yes, definitely.
Emotional stress or mental stress?
Yeah, definitely.
Okay.
As I was talking about asthma, no, there are different causes of asthma. So one of the causes what we have come across is allergic asthma, occupational asthma, like during our occupation, if any allergens or any pollutants come, and exercise induced asthma. Due to
Okay.
exercise, the problem might aggravate, and also
Mm-hmm.
stress induced asthma. There is something
Mm,
called stress induced asthma. Whenever there is a stress, the hormones are released. Those
mm,
stress inducing hormones cause bronchospasm. As I said, Bronchospasm is nothing but the closure of the airways. So
Hmm.
there is a no easy entry of air, and there will be tightness of the chest also. So that's how it is affects.
Hmm. Okay. So, like, you mean to say that like those hormones will release and that spasm will release whenever we get that stressful situation. So that's why
Yes,
many people feel tightness in their neck and they feel breathlessness. When
yes,
they are emotionally charged, they feel breathlessness. So it's so connected. Our body is
yes.
so connected. Like how so we may not be connected with our spouse or our family, but our body always stay connected and work together as
Yeah.
a team. So
Yes,
like
definitely. Yeah,
yeah.
one important point you have raised, Badri. I would like to address that. A few days back, when I was doing the breathing exercise, the meditation, so when I was in the deep meditation, one thing what I realized is that what I have with me is only the breath. Breath is with me.
Hmm.
I'm not alone. Whether anybody can give company or no, but definitely my breath will accompany me.
Hmm.
So that was the greater realization. Yes.
Hmm. True, 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 true. So
Yeah.
that's how the breath is, the importance of breath, dear friends. It's like when we born, the first thing we do is inhalation. When we die, the last thing we do is exhalation. So in between, like we are keep on breathing. So breath is with us for our whole life. Once it is gone, there is no use of this body. So that's how they have to understand and really work on improvising this. If you have any questions, please type in the chat box. And thank you so much, Dr. Rashmi. And would you like to share any closing comments to our audience, like in terms of maintaining holistic health or anything in your with your personal experience seeing the patients? And yeah.
Okay. Yeah, this post-COVID pandemic era, maintaining healthy lungs is very much important. And also, I just want to, express that we have this life is a present. It is a gift. We have to live in the present, and why
Hmm.
not utilize this present in a best way? Have a healthy life by having a healthy habits, by having a healthy food habit, healthy physical habits, healthy sleep habits, and also in the form of uh, uh, breathing exercise, and not only that, um having good health itself is a present for
That's
us. It's a
yeah, healthy routine like nutrition, in terms of
yeah,
nutrition,
health,
any form of
yeah,
exercise.
nutrition.
Yeah,
Yes,
any form of
having
exercise.
a healthy food in the form of vegetables, fruits, lean protein, and definitely they will add on to the health. See, one thing what I want to say: if you want to live a better life,
Hmm.
healthy life, if you want a healthy lung, if you feel that you have a healthy lung, so you should be able to climb the stairs as though
Hmm.
you have not you should not feel after climbing the stairs you should not feel that yeah, I've submitted the
Breathlessness.
Mount Everest. It should not be
Yeah.
that very difficult for you guys. And
Yeah.
also, as everybody celebrate their birthday, so whenever you are celebrating your birthday, whenever you're blowing the candles, so with a one go you should be able to blow out those candles. There should not be need of any second blow to blow the candles.
Hmm.
That much should be your uh, healthy lung status.
Capacity. Yeah, exactly. So it's very easy to monitor now. Like you gave two examples. One is like everyone, those who are watching this, just go and climb at least 3 floors and see like
Yes.
whether you are able to climb easily or like you are facing any difficulties while climbing. And also second thing is try to blow the candle in one shot. So and
Yeah.
see like whether you have healthy lungs or not. So that's very
Yes.
simple, like simplified. Thank you so much, Dr. Rashmi, and deep
Yeah.
gratitude to you for taking your time. And we need more doctors like you to encourage the patients and for holistic health, not just about physical health and maintaining that optimal health. It's not only about during the treatment, it's also after the treatment, how you have to maintain and manage your health is very very important. Thank you so much for working towards sustainable health. And our mission and vision is same, like to help the maximum people in however way we can. If you have any questions, feel free to reach out to us and we are happy to help and answer your questions. Thank you so much.
Thank you so much.